started. Kristen Hunter is joining us tonight from Texas, I believe, unless she's traveling, but she was born and raised in Phoenix, Arizona, and had a childhood draw to dentistry. Kristen sought and obtained her degree in dental hygiene from Rio Salado College in Phoenix, Arizona, and at her first hygiene position back in 2009, she was introduced to the diode laser. So if we really think about it, she has at least a dozen years or so with diodes, and I think a lot of that experience will be helpful to you as you listen to the program this evening. Kristen began serious study of lasers a little bit later in 2016 and completed her standard proficiency with the Academy of Laser Dentistry. For about 11 years as a clinical hygienist and serving certainly in other roles in the dental practice, she became active in the dental community around teaching, educating, and peer experience, founding Dedicated Dental Hygiene. Kristen serves on the Academy of Laser Dentistry Auxiliary Committee and is approved provider of ALD standard level certification. When she's not doing this with us or traveling around teaching and educating, she likes to spend time with her family and dogs back home in Texas. So with that, it's my pleasure to warmly introduce tonight's speaker, Kristen Hunter. Kristen, take it away.
Hi, and thank you everyone for joining us this evening for our presentation. It's called Lasers in Dentistry, What It Takes for a Successful Laser Program. Now, one of the things that I'm coming across and I'm seeing is sometimes once people start getting into lasers and developing a laser program, there can tend to be a few bumps in the road along the way. And the intended audience tonight, or with this presentation, what I wanted to get across was, if you're thinking about implementing lasers into your practice, into patient care, or maybe you have recently gone down that road and already gotten lasers in your practice, but you're not quite sure what to do or where to go from that point. As David mentioned, I am the owner of Dedicated Dental Hygiene. I established this organization back in 2018. And what we focus on is providing laser certification and continuing education events for dental professionals. As David mentioned, I'm based in Texas. I am actually home and not traveling this week. I'm also working with the Academy of Laser Dentistry and helping to provide certification courses for the organization. So I've been with them for a few years now. Our objectives tonight, we see that lasers are growing rapidly in dentistry, and one of the best ways we can utilize that laser is in the hands of a hygienist. We can provide a lot of different beneficial therapeutic things with our laser, a lot of procedures we can provide for them. And so with our presentation, we're going to go through some certification options, what your education could look like before you get into lasers. We'll slightly review the types of lasers that are out there and available to the dental practitioner. We'll kind of do a brief overview on how laser requirements in education can vary state by state. And then of course, implementing and what it looks like and what other roles in your dental practice can really help develop the laser program that you desire. Me personally, I'm married. I have a stepdaughter. She lives in Hawaii. What's nice about that is when your kids grow up, you get to go visit where they move to. And so I got to see her a few weeks ago. Got a couple dogs and some chickens. Some disclosures about this presentation tonight. I would like to extend a big thank you to BioLase for sponsoring our program. The content that I will be reviewing with you is a combination of my slides, and I do have some videos in there from one of my colleagues, Lynn Atkinson, and I don't get endorsed to discuss any particular products or anything like that. First, I want to start by reading a statement from the American Academy of Periodontology. Periodontal health should be achieved in the least invasive and most cost-effective manner to the patient. A broad range of therapies do exist in periodontics, but no single treatment can provide the only means of treating anyone or all periodontal diseases. And that's what the laser can provide for our patients, is minimally invasive dentistry. It helps with their periodontal health, helping to reduce bacteria, bacteremia in the bloodstream. So something that we can provide to our patients and offer to them whenever they come in for their dental appointments. And people have a very positive view of lasers in dentistry. 69% of people surveyed thought lasers would make their visit to the dentist easier. And we know what kind of a rep we have. So whatever we can do to make our patients feel comfortable, like we're giving them the highest care possible. Patients are out there seeking laser practices and seeing, it can provide a benefit for them and their oral health and oral hygiene. And we know that gum disease is so prevalent within our population. It represents one of the most important health concerns worldwide and is probably the most chronic infectious disease among humankind. So we have a lot of disease that's out there that we can treat with our lasers and help provide those individuals with better oral health. And we will just kind of start by reviewing what laser stands for. It is an acronym for light amplification by stimulated emission of radiation. The first laser was fired off on May 16th of 1960 by a gentleman named T.H. Mayman. So he was the one that's credited with inventing the world's first ruby laser. I'm just going to kind of review different lasers on this electromagnetic spectrum. I'm going to discuss wavelengths just briefly because I just want to give a little bit of background information before we dive into implementation and everything else. So with lasers on the electromagnetic spectrum, we have argon lasers. Those were a type of a gas laser that were at one time used for curing composite. Your diagnodent technically is a laser at 655 nanometers. We have our 810 diode wavelength. We also have the 940 wavelength, which is a proprietary wavelength to BioLase. This is what they make their Epic X in. We also have the 980 wavelength, which is what they make their Epic H in. We have what's called an Nd:YAG laser. And this was the very first laser intended for use in dentistry, specifically developed back in 1989. We have our erbium chromium YSGG wavelength, which is both hard and soft tissue purposes. We have the YAG wavelength, and then we also have our CO2 lasers at 10,600 nanometer, 9,600 nanometer, and 9,300 nanometer. And the wavelengths that we're working with, I don't want you to associate with your harmful X-ray wavelengths, which is what we're going to see more towards the left-hand side of the electromagnetic spectrum. The shorter the wavelength is, the more it can enter the nucleus of a cell and cause harm. So that's where we start to see your X-ray wavelengths, where with our lasers, we're not using those harmful wavelengths. It's non-ionizing radiation. Depending where that laser is on that electromagnetic scale will tell you what it's attracted to. So it's going to be attracted to a chromophore in tissue. And with our diode lasers, they are very attracted to melanin and hemoglobin and that dark, pigmented, pathogenic bacteria. So that's why it's useful in treating gum disease. Now, what type of laser is the best? It's kind of like asking what type of tool is the best. What is it that maybe you're looking to accomplish as a clinician? Will help kind of point you in the direction of what type of laser might be right for your practice. Maybe you want to complete hard tissue restorations or do procedures without having to give anesthetic, or maybe provide a therapy called photobiomodulation, which we'll touch on just briefly. So how can the practice benefit from the laser being introduced? Well, we just saw a couple slides ago, people will generally view these practices positively when they know that there's all this type of technology. Does it replace a procedure or particular technology? A lot of clinicians may get a laser for cutting procedures, maybe a soft tissue laser for frenectomies or gingivectomies in the hands of a dentist. Increasing productivity, being able to complete procedures in a less amount of time, and seeing productivity increase in the hygiene department when we're creating and more value around really developing periodontal care and periodontal therapy within that hygiene department. Limitations, that could be, if you get a soft tissue diode, you're not going to be able to do hard tissue procedures. So that would be that type of a limitation. So look at what it is that the practice is wanting to do with that particular device. And will it improve patient care? It will absolutely improve patient care. We have a few studies we can reference and where we did see positive results with the use of lasers and periotherapy. One back in 2005 by Moritz, it showed that it helped with a 90-day reduction of colony-forming units following periodontal therapy. And we've been able to use lasers in dentistry since 1989. That's when an American dentist designed the very first laser specific for use in dentistry. That was the Nd:YAG laser. The diodes came out about 1995, and by 1999, most of those diodes on the market had been FDA cleared for minor perio and oral surgery procedures, including subgingival curettage. So when you purchase a laser, you're going to get a user manual. In there, it's going to tell you what that device is actually FDA approved to do. So this could be something that maybe you point out to your patient who is not quite understanding of lasers and how safe and effective they are with use in dentistry, is letting them know, these are FDA approved procedures. This is what this device has been meant to do. Diodes are going to be a very common laser you'll come across in dentistry. These are soft tissue lasers attracted to melanin and hemoglobin, so that's what it's going to seek out in the tissue. Wavelengths for these particular units are between 810 to 980, and some of what we're seeing on the market now have attachment for pain therapy, which can be very useful in helping our patients with for those individuals that might suffer from TMJ disorder and having head and neck pain. So diodes are small units, very, very easy to use. A lot of them are made with preset buttons. Of course, you always want to base what you're doing on your patient with what their gum tissue looks like, how much of that chromophore is present in there, and that will help direct you on what the appropriate type of setting is going to be for you to use your laser on. Hard tissue lasers are out there as well. They've been FDA approved back in 1997 with the erbium lasers. So these are attracted to water and hydroxyapatite, which is where we're going to see that they're used in hard tissue restorations. Typically, we see only dentists using these particular lasers because of that high attraction to water and hydroxyapatite. Here's an example of some erbium lasers. Some units are large and you have wheels and you have to move around the office. So thinking about portability might be something you want to take into consideration. How large your office is. If you only purchase one laser, how are we going to get it from one room to another if we've got a big long hallway and we've got an expensive device that we're using or trying to transport. There are carbon dioxide lasers, depending on what wavelength will let you know if it is going to be the soft tissue only laser or CO2 wavelength, or if it is the 9300, which is one that's attracted to and can do hard and soft tissue procedures. So there's an example of some CO2 lasers. Again, these are large units. Usually they've got wheels and you have a handle and you're going to move that throughout the office if you need to switch that in between operatories. Now, costs of investing in lasers, if you're someone who's maybe just starting to look at this, and what is it that you should be expecting when you start looking between all the different units that are out there. What we can see is, well, first you want to think about what is the needs of the practice? How many of these units do you need? What's your budget for these units? And that can also help direct you in a certain direction of a particular unit. And deciding first how many you need. I know a lot of practices, when they look at investing in this type of technology, they can see these dollar signs of these units, and needing multiple ones can kind of add up. But if you're in a large practice with multiple hygienists and multiple clinicians, having that patient or having the clinician have the ability to reach over and grab their unit when they need it, you'll see a large increase in how frequently they are using them. Diodes can range anywhere from $2,000 to $10,000 on the higher end. CO2, so the 10,600 wavelength, you could, which is soft tissue only, you could purchase that one used anywhere from $8,000 to $14,000. A new one is going to cost you upwards of $25,000. Your hard tissue lasers may fall between $50,000 to $100,000, and then with your with the water lays in particular, that can be anywhere from 65 and up. So looking at how many of these units you need and what you want to be using them for within the practice. And then your next step might be to look at, well, where do I get my education? In between every state, we can see a lot of varying recommendations or requirements on education. So what we typically see is some states have set forth in their State Practice Act that the clinician undergo a certain amount of training prior to using that laser in the practice of dentistry. And one of those resources for education is the Academy of Laser Dentistry. What their mission is to do is to improve the health and well-being of patients through the proper use of laser technology. So what I want to touch on with that is when you start practicing with your laser and developing your protocol and things that you're starting to see make a positive impact on your patients, we may see treatments vary in between clinicians on what they recommend and how they may practice with their laser. But as long as you're being safe and staying within your scope of practice, you can alter your treatment as you see fit to best fit the patient base that you are serving as a clinician. They have different levels of certification. A standard level certification through the organization can be attainable after completing a live course with an additional 6 hours online and also completing a 75-question multiple choice test. And then they also offer advanced proficiencies, and those can take a few years to complete because you are developing clinical case studies as you track your patient and record their results from the treatment of your laser through non-surgical periotherapy. But the definition of certification is the action or process of providing someone or something with an official document attesting to a status or level of achievement. And what most states require, and we haven't, not every state is going to require laser education. Some state practice acts are unclear whether the hygienist or dentist needs to meet any form of certification. But a lot of times states will require that a clinician gets a certain amount of continuing education credits. And that's what serves as your certification for the state board for the state that you're in. I want to touch on safety. This is probably one of the most important things that we need to remember in laser dentistry. We want to be safe for our patients. We want to be safe for ourselves and of course our coworkers. Each unit is going to come with some glasses. They need to be properly cleaned as they're serving as your eye protection. And 71% of laser injuries that are reported are to the eyeballs. So definitely protect the thing that is most likely to be injured, and that is your eyes. We only have 2 of those. So understanding how to properly clean your unit is appropriate as well. Some may want a special cleaner used on them. You want to be careful about not getting certain parts of your handpiece wet with caviticide. One safety step that we do in laser dentistry is we always test fire our lasers before we start using that on our patient. This is how we can double check our setting, make sure we're at the appropriate setting for the patient that we're going to be working on. We want to make sure the unit's going to work. Unit maintenance is something that you want to also look at. Some states require that you're having these units calibrated 1 time a year. So you want to check with your radiation safety board and see if there's any particular requirements that you need to meet to keep using your laser year after year in your dental practice. Each laser unit will come with some safety information that's specific to the unit. We have something called the maximum permissible exposure, the nominal hazard zone, and nominal ocular hazard distance. These zones on each device can vary between manufacturers. But if you're in that nominal hazard zone of a laser, you are required to be wearing your laser safety glasses. This is the zone where the level of reflected or scattered radiation exceeds the MPE and can cause damage. If you step out of that zone, that energy does not exceed the maximum permissible exposure. We don't need to wear glasses. And it's good to know what that zone is for your particular unit. Some units, it could be 6 feet, some units it can be 8 feet, other units it could be 15 to 20. So knowing those parameters for your device and what you have in your practice is also really important. And typically an office will elect what's called the laser safety officer, and that individual is responsible for knowing all of the parameters of the laser. They make sure the laser is maintained. They're also known as what's called the keeper of the key. So they have certain responsibilities. So look and sit, and decide who in the practice would assume that responsibility responsibility of being a laser safety officer. I live in Texas, and we actually have to register those individuals with our radiation safety board. So again, knowing specific things for the state that you reside in when it comes to utilizing these class 4 lasers in your dental practice. It's important that our dental assistants are involved. They would be maybe the ones to set the laser up for the hygienist, set it up for the dentist, making sure, you know, it's being properly, having a tip placed on it, or maybe if you have a device where you have to strip and cut and cleave your fiber prior to using it. Again, they're going to be the ones most likely possibly cleaning the unit. So getting your whole staff involved on your laser program and understanding what's going on in the back office with our lasers. They need to be aware of safety as well. Again, knowing to wear those safety glasses and definitely cleaning them properly. Sometimes clinicians make this mistake of using cavicide wipes, which break down the optical density, which is the layer of protection that's over those particular lenses. And so what you'll start to see after a while is that it's peeling and it's no longer protecting your eyes or your patient's eyes. So having those assistants be aware of the infection control and the maintenance that comes along with our devices. These are those glasses I was just discussing. They're wavelength specific. So let's say we're in an office where we've got erbiums and CO2s and diodes. You want to keep those glasses with the particular unit that they came with. If you maybe get them mixed up, you can always look at the very, very fine print on those lenses, and that'll indicate to you what wavelengths that particular set of glasses is going to be covering for you, because this is going to be specific to a wavelength. So we're not going to see glasses that cover all of the wavelengths out there. So make sure you're wearing the appropriate glasses, cleaning them appropriately. Can't stress that enough, because these are, you know, $200 and $300 pairs of glasses. And if they're not being cleaned properly and we ruin that optical density, now we're throwing them out, and practice owners aren't very happy when they have to buy those expensive safety glasses. Some signs of that eye exposure being that it is, you know, most commonly going to happen to an eye getting that injury: headache, really watery eyes. They may feel gritty or sandy. You may experience a burning sensation, popping noises. You might see those little black floaters that go across your vision. You may have no pain at all. So important to wear those. I touched briefly on, you know, possibly the dental assistant having to set up the laser for the doctor or the hygienist. Here's one example of what some units may have. It's a strippable fiber, and you're utilizing your cleaving knife and your microstripper device to take off that blue protective coating to expose that quartz glass. So on a diode laser, this is how that energy is getting into that patient's tissue. So again, depending on what kind of laser you've got, you may have preset tips or something like this, like a strippable fiber, or you might have a glass tip or a metal tip that you're reusing and cleaning and sterilizing in between every use. So when you go to buy that device or look at adding into your practice, look at what that maintenance looks like, how you're setting it up, how easy it is for your staff to utilize it as well. With infection control, we're always going to put the preset tip or that fiber into the sharp spin. Beware of your flammable materials. These are heat devices. And with our aerosols, we can create an aerosol called a plume, and that's why I always want to use our high evacuation. What we see with the water lays, it creates less aerosols than your traditional handpiece. And I know with COVID and the pandemic, we're all very aware of these aerosols that are in our air, and they're getting put there by our instruments. So let's get into our hygiene procedures. Different procedures for the hygienist: herpetic lesions, desensitizing, photobiomodulation, LBR, or laser bacterial reduction, and laser assisted periodontal therapy. So what you're allowed to do with your laser will definitely be dictated by your State Practice Act. So look at your State Practice Act, examine that. What is in your scope of practice? Some states specifically say the hygienist can only use this for laser bacterial reduction. So make sure you know exactly what's in that State Practice Act and stay within your scope of practice. One use of the lasers, we can use it for tooth desensitizing. This is done by dehydrating the tubules of the tooth. I find this to be a very valuable procedure that we can provide to our patients, because after treating them with your laser on that surface that's sensitive, most patients report no pain at all. We can also do photobiomodulation. So this is that type of therapy that can be applied to our patient's head and neck area. Again, depending on the state and your state practice act, make sure you're staying within your scope of practice. By definition, it's a photochemical reaction where light energy of a certain wavelength, intensity, and duration that we refer to as a therapeutic window gets absorbed on the cellular level. So we'll see improved circulation, more enzyme activity. It's going to help with temporary relieving pain. Again, improving blood circulation. We can see that can help us relax the muscles. So maybe providing this to the patient before starting a procedure and getting their head and neck muscles a little bit looser. Decreasing inflammation, it helps to facilitate the movement of lymphatic fluid. We're going to see faster healing times. So we'll definitely see this wound healing effect with our patients' bodies. And it helps to really help the function in cells that are stressed out. This is one example of an attachment. This would be used extraorally for an individual possibly experiencing head and neck pain or some TMJ issues. We can treat oral lesions, aphthous ulcers, cheilitis, herpetic lesions. Here's one case that I had come into my chair. This was the Friday before he was supposed to go to 8th grade. So his mom is actually a hygienist, called me, didn't have a laser at her office, unfortunately. So brought him over. We were able to treat him and get him in that day. The herpetic lesion treatments can take 5 minutes, maybe. That's what he looked like the next day. So we saw some really accelerated healing with that huge herpetic lesion. So that was 7 days later. And so he was happy to have that treatment done before he had to start that first day of 8th grade. We'll treat them in a non-contact mode. Usually I'll start with my energy low and then work that up. And your time can range. Usually about 5 minutes, I would say, is on average is the amount of time you'll spend treating that outbreak. And the benefits are great. Patients love this service. It helps to shorten that outbreak. They feel better immediately. When I was treating his lip, he said that felt tingly and he felt like the inflammation had started to reduce in his lip. And some patients report after that they rarely get those lesions anymore. Now we'll touch on our hygiene procedures that you'll see the hygienist mostly utilizing in the chair. We've got laser bacterial reduction, laser assisted periotherapy. So these are going to be the two main procedures we'll see hygienists using the laser for. Absorption. This is what we need to have happen in the tissue in order to get that energy into our patient's tissue. And your amount of absorption will depend on the chromophore of the patient's tissue. So again, for our diodes, melanin, hemoglobin. So with LBR, we're just administering low power laser energy throughout the sulcus in the entire dentition. Usually we want to do this in conjunction with mechanical instrumentation. Some offices may have this as their policy to do it before they start their cleaning. Some have it at the end, so we may see it pre or post-operatively completed. It helps to reduce bacteria. We're going to reduce cross-contamination, and it helps keep that bacterial load down for several weeks following that cleaning. And here's an example of what that looks like. So taking your tip, placing that about 1/2 to 1 millimeter below the tissue and just gently sweeping that through your patient's sulcus, keeping it parallel to the tooth and then roll it into the caul as you make your way through. When I complete this procedure, I'll usually go in my probing sequence. So I'll go through the whole mouth. And this can take 3 to 5 minutes. Patients really, really do like this as an add-on to their hygiene therapy visits. Now with laser assisted periotherapy, this is what we're going to do once we've completed scaling and root planing. And with laser bacterial reduction, we're not looking for a tissue interaction. Now with laser assisted periotherapy, we want to see a tissue interaction. And this is where a hygienist would complete her curettage procedure if that was within her scope of practice. And you can see some immediate results from your patients when you treat them with your laser. This example here shows a huge reduction in inflammation. Those lasers can really help draw out that inflammation, that fluid, and you'll see a difference. So you'll see what you're doing and how you're helping and how you're benefiting that patient with your laser. Here's an example of laser-assisted periotherapy. So this is going to be completed in a cross-hatching motion. And again, this is where a dental hygienist would do curettage if that was within their scope of practice. If you can't do curettage, what we're trying to do here is provide more of a profound decontamination. Want to stimulate some red bleeding coming from that pocket. You even may start to see some debris collecting on the tip of your fiber as you work your fiber through those pockets. And then here's an example of hemostasis. And this is taking that fiber and kind of just moving that through that pocket and helping to coagulate that blood following scaling and root planing. How to propose to your patients. How is this something that you can bring up at your appointments? I always touch on, this is an enhanced cleaning. My laser cleans your tissue. My curettes, my ultrasonic, they clean your hard root surface. So if I can't use my laser, I'm not really providing you with the best cleaning that I can. And as a hygienist, I really want to make sure that I'm taking care of you in as many ways possible. Bringing in their systemic health. Typically, when I'm proposing laser bacterial reduction with their appointment, I'm reviewing the health history. And if we have systemic health conditions, I'm going to take that, relate that to their mouth, and make it something more personal so they feel as though, with my condition, whether it's you're a diabetic or you have a heart disease, or maybe you have a joint replacement, how this will specifically help you and specifically be better for your health and better for you when you're here for your dental visits. And then, of course, gum disease. We want to prevent infection. We want to help them control infection or maintain some form of periodontal health. So we have a couple talking points that we can really use to explain what we're doing with our laser to our patients, and so that they understand the benefits that they're getting when they have those add-ons and we have those services added on to their appointments. Of course, making sure you're staging and grading. That was developed back in 2017. They had over 100 experts from all over the world. They spent this whole month at a hotel in Chicago. It was like a never-ending dental conference. What they did is they developed different categories, and now we should be staging and grading our patients. So this is where we're going to look at their clinical attachment loss, and we're going to stage them based off of those areas where they have bone loss. We also will be grading them. So that's going to help us, rate the progression of their periodontal or their responsiveness to your standard therapy that you're providing with your laser. So again, we want to first start by planning. What do you want to use your laser for? What's its intended use within your practice? Is the staff willing to incorporate? Time in dentistry is so precious. We have, when it comes to hygiene, maybe an hour appointment where we're expected to take x-rays and exams, and we have all of these valuable screenings that we want to provide to our patients. Is your staff willing to incorporate and to get behind your investment in this technology and bring it as part of their patient care and really grab onto that? When we go into different offices to help with training, we do find that sometimes people, it's just one more thing they have to do. But when you start doing that consistently and you get these patients back that look healthier than they did last time, and when they respond to your non-surgical periotherapy in ways you never thought were almost imaginable, that's where we start to see clinicians not wanting to practice without their laser. Getting in there, using it, developing your protocol, and use it consistently. Because if you're seeing a person, every 3 to 6 months, we're going to have to take some time going through all of our patients and seeing them once or twice for these hygiene visits. And then we're going to be seeing patients coming back healthier and healthier. Of course, look at that budget. One thing you want to look at is obviously your budget, but when you decide or you find a unit that you like and you think you want to buy, look at the cost long-term to use your unit. How much do your tip cost? If you do need to get it calibrated, who are you going to be calling for that? And what are the features that you're wanting to incorporate into your office? If you're wanting to do pain therapy and photobiomodulation looks like something that would be very beneficial to your patients, then you want to buy a unit where that's an option and you can use that laser for that treatment on your patients. Look at customer service. Where is your product support when you're done? You go and you spend $10,000 and you buy yourself 2 diodes. and you run out of tips, who are you going to call? Maybe you're in Texas, Arizona, this is where we need to get them calibrated. Who is your contact for that? You know, we want to make sure that you have customer support following the purchase of a product like that. I know personally, when I look at where I'm going to purchase something, I a lot of times look at the customer service side of things if I'm going to be making a larger purchase, because it's really valuable to me to have that personal service or connection to who you got your stuff from. You want to educate. So options for education are, there's many options for education. You can attend a public course. So a lot of times what you'll see is we'll go and set up courses at meeting spaces, whether it's at a hotel or a convention center. We arrange for units to be brought in, and then people can come and attend a course. Sometimes it's all day, depending on the state that you're in and what their requirements are. All of our courses, whenever we go into a state, we make sure it's going to fit those requirements of that state practice act. You can have an in-office training. So what will have happen is a lot of times trainers are getting hired to just come into the practice and work with you and your staff and help getting them on board and using that laser very proficiently. The nice thing about your in-office training is if you are in your appropriate scope of practice, sometimes there's live patient care that can be involved as well. I still maintain my license in 3 states because I go back to train and I help their staff really get that hands-on requirement and get them really very comfortable with what they're doing with their laser. Or there's online or Zoom courses. So that's usually where you get sent a pig jaw and a document camera. And then as time is scheduled, where after you've reviewed online information, you'll usually hop on for some hands-on. So there's a lot of variety to laser education and where you can get that education from and who you can get it from as well. And then of course, implementing. So what's going to happen when you go back to work? After you do attend a course, what does that look like for your practice? Especially if, you were the hygienist, they all said, hey, why don't you go to a course, report back to us what you found and what you think we should do. So where can we connect everything and get everybody on the same page? And that's, again, a hands-on training approach is what a lot of practice owners and a lot of hygienists are seeing a lot of success with, is having somebody to work with you and help you along as you're starting to implement this into your practice. You always want to promote. Remember, 69% of patients had a positive view of lasers in dentistry. Tell your patients. Maybe you have patients that are a lactation specialist or a myofunctional therapist, other professions that deal with the oral cavity, and maybe the lactation specialist needs a referral for frenum releases. Letting them know, with this laser, I can not only complete those procedures for your patient base, but they're going to have a more comfortable experience. They're going to heal better. They're going to have less post-op pain. We're going to have these really good treatment results following the procedure being done with the laser. Form relationships with those providers, again, asking for referrals. Social media posts. Social media, we know, is a place where people get a lot of information. So posting that you're at a course or that you're in your office and you're getting trained and this is what we're doing today. And then the next week following that up with maybe a little video of the hygienist saying, hey, this is what we're doing in hygiene now. This is what laser bacterial reduction is. This is how it's going to help you at your next dental visit. We can't wait to see you. And then another post, maybe with a patient's permission, of maybe that hygienist doing some lasering of maybe their gums or maybe a herpetic lesion, and make a post about that. Hey, don't forget, we can treat your herpetic lesions. Call us, we have a laser. So definitely getting it out on your social media will help with promoting that to your patients. So when they do come in, they already know, hey, you guys have lasers and you're doing all of these really cool things. Can I have that done today? Or is that a service that you would recommend to me? So really word of mouth will help as well. Your front office. So making sure if you are going to develop certain procedure codes, that those are in there, that they understand the verbiage, because most of the time they're being the ones that are treatment planning and going over these costs with patients. Your ROI, this is based on a 4-day work week with a hygienist. proposing laser bacteria reduction at a cost of about $30. So you can see if you've got multiple hygienists working in your practice and you're getting in 6 or 8 of those procedures a day, that can really help boost your revenue for your practice. And this would be an example of if we're only doing it for scaling and root planing patients. So one thing I do see at some practices is they're only proposing with SRP. Your best benefit on patients is if we can do LBR for all of their visits, and then of course adding in LAPT with their quad scales. So you can see anywhere from 2, let's say we have 10 hygienists working at a time, and we're getting in 8 quadrants of scaling day because we have that many practicing at a time. That can again really help drive that revenue. And then looking at your laser cost up front, let's say you spend $6,300 and seeing 8 patients a day and your hygienist completes 5 laser bacteria reduction. And let's say you're going to have this as a service to your patient that you're collecting on, it would take you about 42 days to pay that off. And remember, no code adequately describes the hygiene procedures. Sometimes offices will use a particular code. Sometimes they bundle it with other procedures. Look at your practice and look at what you're allowed to do based on who you may be contracted with. But most of the time, we're never going to see reimbursement. So consider building it into your fee or whatever that looks like based on what your practice is and how you guys operate and what your administration side looks like. All right. Well, thank you guys, everyone, for listening to my presentation tonight. I was so honored and excited to be able to do this.
Kristen, thank you so much. We definitely have some questions. Quite a few were typed into the chat, unfortunately, but I have plenty of Q&A as well. So hopefully they will just be, I'll say, duplicated over in Q&A. If you did just type your question into chat and would like Kristen to get to that, then please do me a favor and just copy and paste it into the Q&A panel. So Kristen, let's see. What is the Karen Morseca, what is the recommended way to clean the protective glasses?
Soap and water, or you could even do like a third mixture of chlorhexidine, distilled water, and surgical soap.
Excellent. Thanks so much. Karen's one of the foremost hygienists in all of Orange County. Thanks for joining, Karen. I am going to probably not say this name correctly. Enzima, I'll do my best, sorry. What immediate emergency procedure can one do if exposed to laser radiation mistakenly?
I'm sorry, what was that?
Yes, what immediate emergency procedure can one do if exposed to laser radiation mistakenly?
It depends on what part of the body would be injured.
Okay, was there a recommendation if you weren't wearing glasses, you were exposed to light? Is there anything that you would want to add to that?
You'd want to call your eye doctor and go in and get a checkup.
Okay, terrific. So Christy Kim, and I can probably answer this one for us, Kristen, she's asking about videos on these procedures, and I'd recommend there were other questions very similar to this. If you go to biolays.com, there are any number of videos. In fact, all kinds of them. We've run this series with hygienists and doctors for well over 2 years now, and every single presentation is archived and put on demand. So you can rewatch, for example, this one in about 2 days' time. But you can certainly search by hygiene, for example, or specific techniques, and webinars that have any of that in it will pop up for you. So certainly welcome for you to go there. The videos, I think that Kristen shared this evening were courtesy of Lynn Atkinson, and Lynn has presentations and videos on there. There's also clinical animations, talk about settings, etc. And you can also sign up for something called the Epic Hygiene Academy, where there are people, professionals like Kristen, that are sharing their information and experience from a peer perspective. So that's the way I would recommend in terms of getting the videos, Christine. And hopefully you'll be able to get what you need there. If not, I'm going to send, at the end of this presentation, I'll put a slide there with an email there that you can send general questions to about support, and we'll do our best to get you the answers. Let's see. This is from Christy Ambrose. Kristen, I'm sorry that this is later than I should have asked, but do you put something over the area when treating sensitivity after dehydrating the tooth?
Sometimes people will place fluoride. I typically, depending on when I was doing this in my appointment, if I was at the beginning of my appointment and I know that a patient had just a really sensitive tooth, I would desensitize in the beginning. If I was at the end and they also elected to have fluoride varnish, I would place the varnish on first, and then I would desensitize after placing that varnish.
Excellent. Thank you. Let's see. This is from Jeffrey Ha. LAPT, initiated or uninitiated tip?
That would depend on your state practice act. So when I practice in California, I could curettage. So I would initiate my tip. Here in Texas, not allowed to do that. So I don't initiate my tip. What you can see though, is it might initiate in the pocket on its own. But depending on where you're at, what's in your scope of practice is how you want to complete that procedure.
Thanks. And a follow-up from Jeffrey that I think is a great question, actually. After LAPT, in what time frame do you probe those pockets?
You can see that some hygienists have differences of opinions when it comes to this. I always did it at the 3-month perio maintenance. So we would see them typically 6 weeks. And at 6 weeks, we would just ultrasonic and laser again. That would be our follow-up visit. And then I would schedule another 3-month. And then at the 3-month is when I would probe. But I've had some hygienists who say, well, I want to wait a year, and they may have their own reasoning behind that. Personally, I was at 3 months.
Excellent. Thank you. Let's see, from Michelle, what setting do you use with the Epic for periodontal treatment after or during scaling and replaning?
What setting? I believe if you're talking about the Epic H, on the unit, it is set to 0.8, 50% pulsed, I believe. And it's going to be number 2 or 3, depending on what state you're in, for periodebridement or curettage.
Cool. Thank you. Christina Cook, is HVE required for LAPT? How's that for acronyms tonight, Kristen?
No, yes, you definitely want to be using the appropriate high evacuation. So the pure evac would be appropriate. Your high evac, I would cut my tip off of the high evac. So that way it's easier to use, because we know we typically don't have an assistant. So reducing the size for me helped a lot.
Excellent. Here's a question about tips from Mary Ellen. What tip do you use, E3 4 or E4 4, and can they be used more than once?
They're single use only, because what starts to happen is that glass will start to break down the more that you use that. So you definitely don't want to be saving those tips and reusing them because that glass does start to break down. And then I use the E4.
Perfect. Thank you. Let's see. What is the difference between LAPT and LBR setting wise? And then there's a little bit of a follow-up, but I thought that was a good stop there.
It depends on your unit that you're using and where you're practicing. And what I mean by that is I traditionally would always use my laser on a pulse setting with a little bit of a higher watt. And then for my curettage, I would usually go with a lower setting initiated tip. But here in Texas, where I'm not initiating my tip, a lot of times what I'll do is still use a pulse setting for LBR, and then using a higher one, and then going with the lower setting. So it depends on what unit you're working with too, because there's other units where I'll do that opposite. I'll use lower for LBR and higher for LAPT. So it just depends on what pulse mode I want to pick, and if I'm allowed to curettage or not for where I'm practicing.
Sure. And I'll recommend Kristen and Dedicated Dental Hygiene as an instructor and educator. She goes all around the country, and she knows better than me, certainly, but better than most, what's allowed in what states. For example, there's a question from Florida, Kristen, about, how they, what can they do with the laser? And I think the easy answer is nothing right now, but certainly
currently, but I do think, maybe just implementing lasers and having the doctor complete the procedure. So let's say you're at the end of your therapy appointment, and if you just set it up for the doctor and they can come in, so that way those patients are still getting the benefits. But yes, unfortunately, the hygienist can't be the one to provide that. But we see a lot of offices that have it being used in hygiene. It's just the doctors coming in and doing it during their periodic exam, or sometimes at the end of the scaling and root planing appointment. And in 3 to 5 minutes for LBR. So it's not too much of the doctor's time to come in and complete that for the hygienist.
Thank you. From Yadria, can we use chlorhexidine as irrigation with a laser? I'm sorry, I'm tripping over my tongue tonight.
I personally don't. I will irrigate afterwards with hydrogen peroxide and water. We know that the chlorhexidine inhibits fibroblasts, so I'm not using that really much anymore for therapy.
Okay. A couple more, Kristen, then I think we'll be kind of at a good break. Let's see. When it comes to LAPT, she said, unmistakenly said LAPD, so I'm thinking about the police department, but LAPT, is it possible to get any results with a non-initiated tip?
Yes, because what we're still doing, we're still going to spend more time in the pocket. We're still going to be, cleaning and cleansing that tissue and helping to stimulate that healing process. So while it's not curettage, when we scale, we inadvertently do a little bit of that, even unintentionally. And so when you go back in with that laser, you're going to help to just stimulate that healing and then also collect any cells that have sloughed off from the inside of that pocket. So you could definitely still see results.
Great. And then the last one from Malia. Should laser treatment, I suppose, be done before or after SRP?
So typically what you'll see is the hygienist will do LBR before scaling. And then once they complete the quadrants, then you're going back in for LAPT.
Excellent. Thank you, Kristen, for your first effort with us on our national webinar series. Very, very impressive. A lot of great comments about your presentation in chat. So thank you so much. Number one.